There is some encouraging news tonight in the ongoing homelessness crisis in Maine. Good evening, everyone. Thanks for joining us. I'm Amanda Hill.
And I'm Brian Yacono. Whether it is the impending sweep of the Marginal Way homeless encampment less than 2 weeks away now, or colder weather that's starting to settle in now, City of Portland staff say in the last 2 weeks they have helped 13 people get into the city's homeless services center. Yesterday alone, shelter staff filled 4 open beds at the HSC in 1 hour by reaching out to people living at the Marginal Way encampment. Portland's Health and Human Services Director acknowledges there are dozens more people to house before that clearing is done on November 1st. And the city's shelters, they're full every night. She says it is time to look at this crisis through a public health lens instead of a social services one.
This is a public health crisis, and we need to look at it like that and try a really holistic approach to address it for the individuals who are there, but also systematically. We talk a lot about the people who are in the encampments for sure, but we are the Health and Human Services Department for the entire city of Portland, and that includes both the housed and the unhoused. And so how can we address this issue and really work to solve this for both communities?
Meanwhile, city staff say people come from all over the state, even out of state, to Portland, in part because of the central location of services.
Those services are critical for helping people out of homelessness, no matter how long it takes. Our Chris Costa has been looking into this in depth for us, joins us live tonight. So Chris, what are the complexities of this population of people living in tents?
Well, Brian and Amanda, one theme we've heard from experts is that the majority of the people living in encampments are struggling with a combination of untreated severe mental health and substance use disorder. Now, shelters do not allow people to use drugs while they are staying there. So many people turn down the option to go to shelters. So why are they struggling to get help for their substance use? I went to several experts for answers. One of the most visible areas that shows the homelessness crisis in Maine is on Marginal Way in Portland. City data show more than 100 tents in that area. Portland police are now patrolling that area more frequently due to growing drug use and assaults there.
There's a very big discussion about this being a housing crisis, or my view on that is it's a combination of some limited housing, but there's also a huge impact of drug use. I feel like the drug use is the big fuel down there that just propels this and keeps them down there.
The struggle for police officers and their behavioral health unit is finding a place where someone struggling with substance use disorder can get meaningful help, such as detox or treatment. There is definitely a limited availability of beds for us to bring people to some type of program. Absolutely. The first step is detox, now called medically supervised withdrawal. Only 3 of those in Maine take MaineCare, Milestone Recovery and Pine Tree Recovery in Portland, and Wellspring in Bangor. Other facilities take private insurance. I mean, it's just limited space. There's a long waiting list. Both Milestone and Wellspring are adding more detox beds. From detox, the next step for many is residential treatment, a place where people spend weeks or months living in a facility and getting medication to recalibrate their brains.
If you've been injecting drugs for 10 years, it takes quite a while in that treatment phase and then in the recovery phase before your brain gets rewired to a normal status. We have several facilities, but we don't have enough beds yet to meet the demand.
Maine's Director of Opioid Response, Gordon Smith, says the state will add nearly 200 treatment beds across the state by 1 year from now. The challenge is finding qualified nurses to take care of patients in those beds.
It's relatively easy to throw money at a project and build beds. You have to have qualified, licensed people.
He says the waiting lists are months long, leaving the people struggling with addiction essentially stuck.
I think just being able to start to say out loud, what are we missing, needs to be the conversation that we engage in over the next few weeks. Because I'm actually really concerned that whatever decision the city makes and the state makes about the encampments, dispersing the problem does not give us more resources to deal with it.
We can't work on their substance use disorder. If they're in a tent and we're going to move that tent tonight, or expect them to move someplace.
Brian and Amanda, we understand that substance use, as well as detox and treatment beds, those are just one of many factors that lead to someone being homeless and staying homeless. So we're going to dive into each one of these issues in depth so you, our viewers, can understand how complex this issue is.
Chris Costa live in studio tonight with an in-depth look. Thank you.